Thank you for listening to Depictions Media Radio.
We are now entering month 7 of our pandemic, and during this time, all British Columbians have been called upon to make sacrifices. For the kids, good morning and thank you. I'm Isabel Mackenzie, Seniors Advocate for the Province of British Columbia. We are now entering month 7 of our pandemic, and during this time, all British Columbians have been called upon to make sacrifices. For the kids, there's been no school, no time with friends, vacation plans upended, no trips to Disneyland with Grandma and Granddad that may have been on the calendar for this year. For our young people, there have been job losses, university plans have been upended, and the major milestones of our life, such as our graduation, our wedding, the birth of our children, have all been altered in the landscape of the COVID-19 pandemic. Interestingly, we are learning that many seniors are handling the psychology of this pandemic better than some, although we know that they are bearing a disproportionate burden of the serious illness and mortality that is caused by COVID-19. However, there have been some silver linings, if you'll pardon the pun, of this pandemic for the seniors of British Columbia and of Canada. It was extremely heartwarming to see the outpouring of concern that we showed for each other, and most particularly for our seniors when this pandemic first began. If we think back into March and early April, across this province, people were expressing concern for the elderly people in their lives. They were checking on their neighbors, on their friends, on their relatives to see if they were okay. The stores and businesses quickly accommodated and established seniors-friendly hours and delivery requests. And across the country, as stories emerged of problems in long-term care, Canadians responded not with indifference, but with a commitment that we must and we will do better. And I believe that we will meet this challenge in the coming years, and it may be one of the most lasting positive legacies from this pandemic. And here in BC, when we were called to action through the Safe Seniors Strong Communities initiative, which in and of itself was a testament to our concern for seniors, as it was the brainchild of an all-party committee who came together in a common purpose, that of helping the seniors of BC. And I just want to thank again the committee, Ronna Ray Leonard, Shirley Bond, Janet Routledge, Sonia Firstino, and John Yap, because as a consequence of their bipartisan efforts and commitment and energy, BC responded with extraordinary generosity. Currently, over 14,000 seniors have been helped by over 10,000 volunteers who have completed over 140,000 virtual visits, reaching out to seniors throughout BC who are home, often alone, making sure they're okay, having a conversation with them, and ensuring that they continue to be connected to their community through this pandemic. There have been over 25,000 grocery deliveries by volunteers. This is helping out those who can't get to the grocery store or are concerned about the exposure in the grocery stores, and it's helping our overburdened grocery system in BC, who's been met with unprecedented demand for grocery deliveries. And over 60,000 meals have been prepared or delivered by our volunteers through 211 over this pandemic. Unfortunately, none of them have found their way to my house, but it is very heartening to know that every day in this province, thousands of seniors are enjoying a meal that has been prepared and delivered by a volunteer who cares very deeply about them and their well-being. The federal government has stepped up. They've offered some additional financial support. There's been one-time payments through OAS and GIS, and there's going to be additional payments for people with disability tax credits. There was a lot of effort made to ensure that low-income seniors were able to file their income tax. Extensions were made so that people can continue to get their GIS. At the federal level, there has been a significant amount of concern and focus on ensuring that seniors in this country are not negatively impacted to the greatest extent possible by COVID-19. Here in the province of BC, there have been some very meaningful supports for seniors. There was the additional funding for the BC 211 Safe Seniors Initiative, and also there's been an additional payment for our lowest income seniors, those who are on senior supplement, of a $300 a month payment. This is very, very significant. These are our lowest income seniors. These are about 60,000 seniors in BC who live on less than $20,000 a year. And to put it in perspective, a minimum wage job would be about $26,000 a year. So it's very meaningful support for these seniors. And when it's added to the increases in Better at Home, what we have found is that we have both a wider and a stronger safety net for low-income seniors in BC during this pandemic. However, without a doubt, one of the most heartbreaking sacrifices that has been required of seniors and their loved ones has been for those 40,000 or so seniors who live in long-term care and assisted living that went without visits for over 3 months and who are still struggling with our revised visit limitations that for some are bearing very little resemblance to their pre-pandemic visits. It is also clear when I listen to family members that they have been impacted. Their own health and well-being is at risk by their not being able to see their loved ones. And this is trickling down as I also hear from frontline staff and many care home operators who are feeling the impact and the burden from the visit restrictions that we have been required to impose. Every day, my office hears directly from family members and some residents about how they are struggling. As I said, we are in month 7 of this pandemic, and we know that we will likely be living with it for the next year, perhaps more. That may not be forever for me, but we need to be honest and recognize that it is forever for some of our residents in long-term care and assisted living. Tragically, during this pandemic, about 125 seniors in long-term care and assisted living have passed away from COVID-19. However, over this same time, more than 2,000 other seniors living in long-term care and assisted living have passed away from something other than COVID-19. What was life like for them and their loved ones in the final months, weeks, and days? We need to better understand the totality of the impact of COVID-19 on the people who live in long-term care and assisted living. I know that for me and for my colleagues in public health and long-term care, this is one of the most difficult, if not the most difficult issue to tackle. Long-term care homes and assisted living residences are shared environments where the decision to put myself at risk also puts you at risk. And so we need a balance. And the question is, where is that balance? Yes, we want to keep people safe from COVID-19, but what are we keeping them safe for if it is not to enjoy what is left of their life? And for some, their only enjoyment is the time that they can spend with their loved ones. Before COVID-19, some people visited their loved one every day, and sometimes for the whole day. To suddenly go from that amount of personal contact to none, and for it to happen effectively overnight, was very, very difficult for many family members as well as for residents. About 2 months ago, I think it was June 30th, we revised our visitor policy. But for many family members and residents, it is still very, very different from the reality of their visits before COVID-19. Every family member and every resident in long-term care and assisted living has a unique story to tell. This story needs to be told. It needs to be told in their own voice, and it needs to be heard by all British Columbians. So today my office is launching a province-wide survey to ask residents of long-term care and assisted living and their family members to tell us about what their life was like just before the pandemic hit, what it was like at the beginning of the pandemic, and what it is like now. We need to hear these stories as we shape our future. The survey can be found at carehomevisits.ca. I'll repeat, carehomevisits.ca. Family members and residents can answer the survey online. They can print off a copy of the survey, complete it on paper, and mail it into my office. They can call our office at 1-877-952-3181. I will repeat, 1-877-952-3181. And we will mail a copy out with a stamped returned envelope. We will also, if you want to answer the survey over the phone, book a time for you to meet up over the phone with a volunteer who will take your answers over the phone so that you can participate in the survey. And if English is not your first language and you would like to complete the survey in another language, you can also call my office and we will make translation services available. To all residents living in long-term care and to their loved ones, I want to say, you have our ear. We want to hear about your experience, and we want to know what you think we can do to manage visits in long-term care and assisted living as we all live through this pandemic. If you know someone who has a family member in long-term care or assisted living, please encourage them to answer the survey. We need to hear their story, and we need to hear it in their voice. Again, the website is carehomevisits.ca, or you can call our office at 1-877-962-3181. And I hope everyone who has been impacted by these visit restrictions will be able to find the time to answer this survey between now and September 30th. I thank you, and I will now take questions.
Thank you. As a reminder to reporters on the phone, please press star 1 to enter the queue. You are limited to one question and one follow-up only. Please take your phones off mute. You will not be audible until your name is called. First question is from Marcella Bernardo, News 1130. Okay, moving on. Next question is from Grant Warkenton, Raven 100.7.
I just wanted to follow up on something that you already said. In terms of getting the survey to seniors in the care homes, it sounds like there's phone numbers. As we know, seniors are probably not going to be using websites. Are there going to be anybody going into the homes to let seniors in a lot of our long-term care facilities know that the survey exists and that they can do it and share their voice?
Thank you. All of the care homes are going to be sent a direct link to the survey, and care homes are going to be asked to distribute instructions to all of their residents on how they can participate in the survey. Some of them actually will be able to complete it online, but not the majority. So we're hoping that they will be able to phone the phone the number and answer the survey over the phone. And family members may also be able to assist their loved one in answering the survey. So we're not going to be able to do the survey as we did our last one, where volunteers went physically into the home to interview residents to answer the survey. That's an unfortunate one of the consequences of our COVID restrictions. But we are hoping through these other means that residents, we will be able to hear their voice as much as possible.
Grant, do you have a follow-up?
No, that's it. Thank you.
Thank you. Next question is from Bob Mackin, Breaker News.
Survey and not an investigation. Relatives of the victims at Lynn Valley Care Centre have gone public with stories of filthy conditions and staffing problems, and they want an investigation. They want an inquiry. But why do a province-wide survey instead?
I'm sorry, I don't think I heard the first part of the question.
Yeah, the question's about, for instance, relatives of victims at Lynn Valley Care Centre. They went public with stories of filthy conditions and staffing problems. So why are you doing a province-wide survey and not an investigation?
There are two. I am familiar with what has happened at Lynn Valley Care Centre, remembering that it was the first care home to experience an outbreak, and undoubtedly there were and are things we can learn from what happened at Lynn Valley, and I think that we did learn from things that happened at Lynn Valley, and they informed how we proceeded with other outbreaks. And I think that looking at the issues surrounding the outbreak, what was the procedure followed, that is a different issue than what this survey is looking at. This survey is about visit restrictions and the impact that the visit restrictions have been having on residents and their loved ones. I do think there are a number of reviews underway that are looking at how did we respond, what could we have done better, what did we learn, and certainly Lynn Valley has presented us with a number of issues, many of which I think certainly my office has identified before, and I think that some of the initiatives we've taken in response to the pandemic are addressing some of those issues, not all of them. Some of them are going to take a longer time to address, and I think we're working our way through that. But certainly we are looking at what has been happening in these outbreaks in our care homes.
Bob, do you have a follow-up?
Yes, I do. Is part of the problem that you've got limited powers? I mean, looking at your enabling legislation, Section 7 says that you have the power to gather information, whereas comparing with the representative of children and youth, who has the power to compel persons to answer questions in order of disclosure, you seem to have one hand tied behind your back. Have you asked Cabinet to give you more power so you can do a proper investigation to get to the bottom of these things instead of, putting out surveys?
That's a good question. One of the enabling parts of the legislation, actually, we do have the power to compel information. We don't have the power of subpoena, but we do have, under the Act, the power to ask the care homes to provide us with the information that would be necessary. What we don't have, and I don't believe the representative for children and youth has, but I'm not sure, I'm not expert in that legislation. We don't have the power to compel care homes to take action or do something. Those powers right now are generally found in our licensing regime through the Community Care Assisted Living Act or the Hospital Act, and obviously through our public health orders. So that's where the difference is, and certainly the power to make recommendations is there, and my office has used that power in the past. But they do have to provide information if we ask for it and require it.
Next question is from Lisa Cordasco, CHLY.
Good morning, Ms. McKenzie. I would like to know, what will you do with this information?
Good question. So when we get this information back, September 30th, my hope is that before or around the end of October, we are able to produce a report out to British Columbians that will say this is the experience of residents and their loved ones in long-term care under the visit restrictions of the COVID-19 pandemic. And here is what they think we should be doing. They may think that what we're doing is what we should be doing. They may think it's different. So we're asking people in the survey, as I said, how often did you visit before? How often are you visiting now? What do you think are the types of visits that should be allowed during the pandemic? And I think that will help us understand how we can shape a visit policy that we can live with for the next year. Because certainly some of what my office is hearing, and while the visit restrictions were on for all but essential visitors, we were hearing quite a bit, certainly as we moved into month 3 and end of 2 and into the 3rd month. Then when we eased the restrictions and had the one designated visitor, there was some time trying to iron out the kinks, for want of a better term. And now, for the most part, care homes have now had about 2 months of living with the revised policy. And we're still hearing some frustrations by family members and by residents. And we're still hearing quite a bit of variation in what care home visits are looking like in different care homes. And we also saw that earlier on around the essential visitor designation. And I think what people are looking for is an understanding of, what will this look like, and what should we be expecting as a minimum as related to care home visits as we look at the year ahead.
Do you have a follow-up, Lisa?
Yes, the Provincial Health Office and the Minister of Health has already said it is reviewing designated visitor status and looking toward increasing more visits. They already know that these two aspects are being demanded by relatives of people in care. So I'm wondering what you hope to add or influence to that discussion.
I think that part of it will be around, there's the issue of do you get one designated visitor, so if you increase that, but there's also issues around the frequency of visits, the duration of visits, the location of visits in the care home, what type of PPE protocols are required to be followed. There's the experience for people who are palliative, and we do have specific questions for people whose loved ones have been palliative through at some point in this pandemic. And I think those are all important pieces to add. We have not had a collective conversation with residents and family members about the impact of these visit restrictions on them. And I think we need to understand that. And I think that will hopefully inform us and inform care homes and give care homes the confidence that they are providing resident-centered and family-centered visits as much as possible within the context of the COVID-19 restrictions.
Dirk Meisner, Canadian Press.
Hi, Ms. McKenzie. Do you why instead of doing a survey, why don't you just come out and say that the restrictions on visits are still too tight and they should be loosened to help families and the elderly people in the care homes?
It's a good question, Dirk. And I think the answer is because I want to hear what the family members and the residents think about these visits. It's their life. It's their visits. And they have a voice in saying what this is like for them and what they think it should be. And my job is to provide the platform for that voice to be heard. And that's what this survey is doing. And so I will certainly be collecting that back. You know, in the normal course of pre-pandemic life, I spend a lot of time out talking directly with seniors in the community, seniors in care homes. That, of course, has all been restricted during the COVID pandemic. And so I have missed that touchstone, for want of a better term, of being able to connect directly with folks. And this is going to enable me to ensure that any recommendation I make is informed by the wishes and the voice of the people impacted by that recommendation.
Do you have a follow-up, Dirk?
Sure. The 2,000 people you said have died in the long-term care homes since the pandemic started and have been diagnosed, did not die directly from COVID. How much do you feel an impact that the COVID possibly played in their deaths?
We don't know yet. There's going to be some interesting things that we will be able to look back on and see the impact of. So when we look over the years in long-term care, approximately 20 to 25% of our residents unfortunately will pass away each year. Numbers can vary if there's a very virulent influenza that year or pneumonia that year. Sometimes the numbers can be a bit different. We might find that deaths from things other than COVID are tracking actually lower than in previous years, in part because we're protecting people not just from the COVID virus, but from all the other bugs and viruses out there. We might find it's increased because we've been unable to focus as much time as we normally would on some of the issues related to their care that has had deleterious outcomes. So have we seen an increase in wounds that have led to sepsis that have led to death? Have we seen an increase in medication errors, an increase in falls? We are looking at that data, but in order to meaningfully look back on it, it's going to take us probably about another month. The data have to come in. They have to be cleaned up, and then we have to look at them. And really when we want to see the real impact, it wasn't really the month of April was sort of the first full month, and we've had lockdowns of 2 weeks in care homes before during influenza season. So it's really looking at, okay, what happened in May, in June, what are we seeing in July? And so we are looking at that, and I'm going to be very interested to see what those numbers tell us, and we will report on those numbers publicly.
Next question is from Rob Monroe, Info News.
Hi, Isabel. Thank you for doing this. I've done some stories on people who are asking for assisted suicide as a residence because their life is so unlivable. I've talked to families who have seen a before COVID perfectly mobile person on her deathbed the night before she died. This is going to take a long time to come through. Do you have any insight into any changes the government is going to be making prior to this survey coming out, or are you having any input in trying to allow more visiting in these places?
Yes. Those stories are, and I have also heard those stories, and we're asking specifically about things like that in the survey. What was your loved one's mobility and emotional well-being before the pandemic? What are they now? What are the differences? We're asking what their palliative experience was, how long they got to spend with their loved one, did they get to hold their hand? Those questions are all in the survey and being asked, in part to, I think, inform us of the magnitude of the totality of this experience. To answer the question around what changes might be coming to the visit restrictions, I know that both public health and the minister are looking at the restrictions that are in place now around the one designated visitor, and can that be increased to allow more visitors? Is it one designated visitor and one care partner, for example, as some provinces have done? Is it the essential visitor and the designated visitor? Are they one in the same? And then there is that whole other issue around the frequency of visit, the type of visit. So the feedback that I'm getting in my office, and I don't know how many of you are getting this feedback from your listeners and readers, but we find a gamut of experience out there. So some care homes are able to offer a visit every week. The person can wear a mask, and so they can be close to their loved one, and they can be in their loved one's room. And then others are experiencing care visits that are once a month for 30 minutes, and that they have to stay 6 feet away, wear a mask, be in a common area, and be supervised. So there's this whole, range in between. And we're trying to understand what is driving that range of visits, because, and should there be a minimum standard? Should it be you are entitled to a minimum weekly visit? You are entitled to at least 1 hour at each visit. Those are the kinds of questions that we're asking residents and family members for their opinions on, because I think that whether it's one visitor or 3 visitors, we still have these other issues, which is how often can they visit, how long can they stay, and what does that visit look like when they're visiting.
Do you have a follow-up, Rob?
Well, yeah, just on those lines, are you being consulted? There are some organizations around that have been lobbying for this kind of thing. Is the government involving you or these people in those discussions? Because I just heard a lot of stuff saying it's got to change quicker because people are going downhill quickly.
Yes. And so the answer to the question, am I being consulted, is yes. I am. The Public Health Office and the Ministry and the Minister are interested in what my office can offer and inform in these decisions and support this survey. And yes, I think that what may not, there's a lot of things related to this pandemic, and there's a lot of moving parts. And right now, there's a lot of things related, for example, to the start of school. But I think we really, really have to understand that time is more important for somebody in long-term care and assisted living because, frankly, they have less of it. And so we do have to, I think, make these decisions as quickly as we can in the context of as safely as we can. And the other overarching issue, and this is always there, and people struggle with, before the COVID pandemic and during the camp, and this is the issue of risk and aging. And it's the same, the risk and life in long-term care. And so we desperately, desperately want to keep our loved ones safe. We want our mom or dad with us for as long as possible. And I have seen sons and daughters and husbands and wives try to hold on to every last minute. And the safety for some is paramount. And we've got to wrestle with this because we're going to be living with this for another year, perhaps more. And as I said, for some people living in long-term care or assisted living, that is their lifetime. And what does it look like? And where is this balance? And I think when we started down this road, I can't speak for others. I can only speak for myself. Back in March, I did not envision it would be this long. Maybe others did. And so I think as the magnitude of how long this is going to last starts to bear down, I think it becomes clear we have got to figure out something that is humane that we can live with.
Marcella Bernardo, News 1130.
Thank you so much. I took my phone off mute this time. I was hoping to ask you about dementia patients and how you hope to try to get information from them, because I'm hearing from a lot of families that are saying that the lack of visitation for them has severely deteriorated their health.
It's a good question, Marcella. And, one of the things, we did our survey of residential care about 3 years ago, And I did some battles with folks about the survey back then because they were saying, oh, people with dementia can't answer the survey, and, let us choose who gets the answer to the survey. And I said, no. We'll just let people choose who can answer. And a surprising number of people who are diagnosed with dementia do have an ability to express their opinion. They haven't lost that ability. They know how they feel, and they know what they want. Some, tragically, are beyond that, but many aren't. And they will be able to answer this survey. They will be able to hopefully answer it over the phone. We're going to encourage family members, if at all possible, if they're able, when they're visiting with their loved one, to help them answer the survey online. You can do it on your iPad. Or, sit with their loved one while the loved one answers it over the phone. Those are options that are available. And so we're hoping that we will hear from as many residents as possible. I'm not naive. I know that it's not the ideal way of doing the survey, but we have to do something, and we have to do it quickly. And this was, for us, the most logical path forward to get people's voices heard.
Marcella, do you have a follow-up?
Yes, it's regarding the BC Care Providers has now named Terry Lake as their CEO, and he was the health minister of BC when Retirement Concepts was bought by a Chinese company, Ambang. Have you had any discussions with him yet, or do you have any concerns regarding the fact that that particular company has had many of its beds taken over by the provincial government because of a lack of care in those homes?
Well, I worked with Terry Lake when he was Minister Lake. It was under him that this office was established and that I was appointed. And I had a very good relationship with him. He and I did not always agree. The current minister and I don't always agree, but both Minister Lake and Minister Dix are incredibly respectful, not just of this office, but of understanding a variety of opinions and the need to have a variety of opinions. So I am very much looking forward to working with Terry Lake in his new role. I think that is a very positive step forward. I think he's going to bring a background of being informed about the complexity of matters. Now, you're quite correct. He also will bring with him some decisions he made as Minister of Health. And he, some of those, as all of us, I've certainly made decisions in my life that in the fullness of time didn't prove to be so brilliant. We all do. And so I think that most of us rise above that and recognize that. And I have every expectation from what I know of Terry Lake that he will do that. You also have to remember that as a former minister, he was also an MLA. And MLAs, regardless of what party they belong to, they hear from their constituents. And I know that on this issue in particular, on the visits, many MLAs, if not all of them, have been hearing from their family members. It's not a partisan issue. And so I think as we move forward, I hope and I expect that it will be a positive thing that Terry has been appointed to head the BC Care Providers. But we have many months and years ahead of us to see that.
We have time for one more question this morning. Our last question comes from Timothy Bergeron, CBC Radio Canada.
Yes, hi, Ms. McKenzie. Isolation, is seen as a health risk, psychologically, physically, and I know the survey will know more about how it impacted everyone, but have you observed any problems now that have been exacerbated in terms of anxiety, stress, depression, that kind of problem? Have you observed anything yet?
That's a good question, and I'm grateful you're asking me only to answer it in English. So the challenge is this. When we did our last survey, which we spent 18 months developing and spent over a year delivering, and it was in person in care homes, we were able to link through anonymized data the respondents' health status by their RISE survey with their answers, and we could know a lot about people. That is that's frankly, as a researcher, where I am most comfortable. We can't do that with this survey. If we wanted to do that, the survey could not get completed before the pandemic was over. So we had choices to make. So we are asking people, family members and residents, to tell us about their health status, both before and now. And we're asking them if there's a difference. These will be self-assessments. And we are also looking at what I call the aggregate data. My office is doing that now. We are looking at the period of time from April 1st, 2019 to June 30th, 2019, and we are comparing that to April 1st, 2020 and June 30th, 2020 to see what kinds of differences we would see. It will be in the law of big numbers. If there's a meaningful difference, it will tell us that. It won't pinpoint the person, but it will tell us that this was definitely happening. It happened to enough people that it's a pattern and it is systemic. We're looking at a lot of other things and impacts through that lens as well. And so we've already looked, for example, at prescribing data. We didn't see, actually, a pattern difference, but we're drilling down into, we made what we call PRN meds, which are medications that are delivered as needed. So you may not see a difference in the first 3 months. It will lag, but we are looking at all of those. Unfortunately, some of the decisions we need to make now, we don't have all the information we need to make that decision, and by the time we make the decision, there have been some things happening that we should have fixed. That is always the case. With this survey, the decision was we need to get this information in quickly. I think people are capable of assessing their own health and well-being, and arguably that is more important at this point in time than a clinical assessment. And so we will be gathering that and being able to measure that. Without a doubt, when I listen to family members and residents, there has been a profound impact. We had a focus group guide us through the creation of this survey. That focus group included family members, it included residents, and it included care home operators. And across all, there's been an impact. And what I was struck by in listening to the family members was that clearly there's been an impact on their loved one in long-term care. There's also been an impact on them. And I am not certain that we have completely appreciated it. I'm not certain that, we focus a lot on the burden of caregiving. We focus on the burden of, I have to do all these things. I don't think we realized, at least I didn't realize initially, that, okay, when that burden was lifted, another burden was placed on their shoulders, actually. And we need to measure the impact of that. And we've asked questions of family caregivers about their health and well-being during this pandemic as well. And so I think we're going to see that there has been a significant impact. And that's where we have to weigh the risks. Yes, we need to protect people from this virus. Yes, we know that the more people that go into a care home, the increased possibility, not probability, but possibility of the virus being carried into the home by that person. And we know that if a virus gets into a care home and it is not detected until it has spread, it can have serious, frankly, deadly consequences. But we need to look at the totality of life, of the totality of the risks we take every time we walk out our door, the totality of the risks living in long-term care. Yes, people, it's serious when they get, and potentially fatal when they contract COVID-19. It's also serious and potentially fatal when they fall. It's also serious and potentially fatal when there's a medication error. It's also potentially serious and potentially fatal when they get a serious wound infection or a pressure ulcer that is advancing to stages 2, 3, and 4. All those things happen. And so we need to look at, okay, there's risk. How are we going to manage this risk? How are we going to live with it for the next year? And we have to involve those directly affected when we make that decision. We cannot make that decision in isolation. And that is what this survey is going to do. It's going to give voice to those people and allow them an opportunity to say what they think things should be. And so I really, really, really hope that as many family members and residents as possible, first of all, know about this survey and answer this survey.
Do you have a follow-up, Timothy?
Yeah, have you observed as of yet, any trends? You're saying you're observing you're looking at a lot of data. As of now, do you see any trends in terms of certain problems?
The short answer is we're still analyzing the data, so I have not been able to see the patterns. The only one we've been able in real time to look at is the prescribing. And so I will expect to be able to provide updates on that in the very near future. I know it will be frustrating to some, and I'm very sorry for that frustration. I know we want to know things, and we want to know them right now. And believe me, those who work with me know that that is my want as well. But it is simply the ability to. We're now looking at, okay, the experience in the first month of lockdown is arguably not what the experience was by month 3 of the lockdown, and so, or visit restrictions, I should clarify. So we need to gather that in, and that's what we're in the process of doing right now. We're doing it as quickly as we can, and I am absolutely committed to reporting out to British Columbians about the findings.
That's all the time we have for this morning. Thank you.
Thank you very much.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.